Today's video is about recovering from hamstring strains. What exercises are most effective to really hasten your recovery from a hamstring strain, and what exercises are not that effective, maybe you should avoid or at least not emphasize in your recovery. So what exactly are the hamstrings? The hamstrings are three muscles on the back of each thigh. One of their main jobs is to decelerate the leg when we're running. And here's what I mean. So as you're running along, one hip is flexing while the knee is simultaneously extending. And at the end of this movement, the hamstrings has to slow down the limb and recycle the next step. But here's kind of the trouble, is in that position, the end of the stride, hip flexed, knee extended, the hamstrings is being pulled. So at the same time it's being pulled, it's also having to contract pretty hard to perform its function. Well, it's no wonder that that's where injuries occur. So what are the best exercises to do? What's most effective in recovering from this injury? So what I observe and have experienced with patients over time is people tend to rely on stretching too much. Stretching has its place, but it won't cure this. The cure is a gradual and really strategic progression of strengthening. And I generally break this down into three phases. So in today's video, I'll demonstrate my phase 1 program. Before I demonstrate the program, I want to remind everybody, click those like buttons, subscribe, leave a comment. So first off, let's just imagine you've just strained your hamstring within the last day or two. This is one of our first exercises. Really simple, really keep it easy. Keep in mind that the muscle is newly injured. We don't want to overwork it. So simply standing, using something for balance, I'm using my bat, I'm simply going to bend and straighten the knee repetitively, okay? Bend as far as you feel you can, hold for a moment at the top of the movement, come down. So what we're really trying to accomplish here is we're trying to prevent too much muscle atrophy while we can't use the leg as we might otherwise. We're trying to prevent adhesions from forming within the muscle. And believe it or not, this can actually help decrease pain. But we really don't want to overwork the muscle at these initial stages of healing. So again, about 10 to 20 repetitions, about 2 to 3 sets of this exercise. Our next exercise is a gentle hamstring stretch. Now I know I said that stretching isn't the cure, which is true. However, after injury, you'll almost definitely lose some flexibility. And to get back to your normal function, we want the flexibility between the hurt side and the unhurt side to at least match fairly closely. So we want to get back whatever you may have lost. So we're going to do some stretching. And here's our first effort. So simply grab behind the hurt knee and gently try to straighten the knee. You're not going to get too far, just until you feel a gentle pull in the hamstring. Again, we're trying not to overdo this. Hold for about 10 to 15 seconds, relax. So not a real long hold time either at this stage of recovery. Straighten the knee, hold 10 to 15 seconds, come down. Again, I can't emphasize enough, we're keeping it gentle. Straighten, hold 10 to 15 seconds. So we're going to do about 3 to 5 repetitions of this exercise. Now we're going to start the strengthening exercises that I keep talking about. And we're going to go through a bit of a progression here. So we're going to start first with a double leg bridge. Doesn't matter which side is hurt, we're going to use both legs. Simply bridge up. Now here's the part that's a little bit different from most programs is we're going to have a hold time. Start with a 10-second hold time, work up to a 30-second hold time, 5 reps, okay? So now, once your symptoms allow you to do that, you can progress to what we call a long lever bridge. So here's the short lever bridge. I have about a 90-degree bend at my knees. So if I bring my heels a little further away, now I have a long lever bridge. Same thing, pick up, hold. We'll start at 10 seconds once we go from the short lever to the long lever bridge, back to the 10-second hold, and down 5 times. I gradually work up to a 30-second hold. Now, to progress from here, we simply go to one leg. So back to the short lever, let's say my left leg is my hurt leg. I lift up, 10-second hold, 5 reps, working up to the 30-second hold, and the last step in the progression is the long lever single leg bridge. And this one gets pretty hard. Okay, so you're not doing this right away. This is going to take several weeks to get to. Okay, again, a 10-second hold at first, working up to a 30-second hold. We call this exercise the straight leg pull down. So I have a rubber band tied around my ankle. It's secured at the top of my closet door. Keeping my knee straight, I'm simply going to pull down against the band almost to the floor, hold for that 10-second count, come back up. Pull down, again hold, working up to a 30-second count over time, come back up. Up and down, 5 repetitions. That's my phase 1 hamstring strain home exercise program. So one question, of course, I get from patients is, when can I go on to phase 2? So when they can go through this program, I tell my patients, with really no pain reproduction or very minimal, and whatever pain reproduction you might get with these exercises goes away right when you stop the exercise. There's no lingering pain. Then you're ready for phase 2. And generally that will occur somewhere around 2 to maybe 4 weeks post-injury, depending on their injury severity. So I think that gives you a little perspective on when you might progress. So I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, again, leave a comment, let me know how you're doing with your hamstring strain recovery, and we'll see you in the next video.